Well, good morning, Team Neil Madden. It's a pleasure to be with you this morning. I hope you had an enjoyable 3-day weekend in honor of Dr. Martin Luther King. I think it's important to recognize that Dr. King was one of the most inspirational leaders of the last century, and he has really led substantial change through nonviolent activism in support of the civil rights movement. And the fruits of his effort have been profound. But as many of us have seen over the course of the last year, there are still many issues arising nationally, and we've observed some of those directly that highlight the fact that we have much work to do. But it's nevertheless important for us to recognize the great work of a great leader and to continue to move forward with the message that he has shared. I also want to take a moment to congratulate two of our outstanding student leaders. Jacob Sweet, a third-year pharmacy student, was recently awarded the National 2021 Pharmacy Compounding Foundation and Pharmacist Mutual Compounding Scholarship for excellence in pharmacy compounding. And College of Medicine student Aviva Aguilar, one of 38 students from across the US, has been selected as a recipient of the United Health Foundation National Medical Fellowship Diverse Medical Scholars Program. So congratulations to both Jacob and to Avila. I also want to recognize some of the local leadership of our students. One of the important topics that has been keeping us busy at the university is the issue of equity in ensuring that students who are in the clinical setting, mostly our M3 and M4 students, as well as our P4 students, have access to the COVID vaccine so that they are protected in taking care of COVID positive patients, and also that patients are protected from spread. This has been a difficult issue for us to navigate, as there has been misallocation, or at least a mismatch in allocation of COVID vaccine to the healthcare enterprises and their ability to get them out broadly to all healthcare providers, including students, which are part of the CDC's 1A category. 4 of our students stood up and took a leadership role in bringing together the College of Medicine and College of Pharmacy leaders, as well as leaders from our health systems, to openly discuss this in an evening forum, and also to serve as forum leaders regarding the discussion itself. I want to recognize one of our M4s, Trey Moberly, another M4 and a College of Graduate Studies student, Prabis Maran Batra, an M3 student, Matthew Hom, and a P4 student, Olivia Pulverin, for really taking control of this situation and helping us to form a plan together with the leadership. I'm going to update you more on that in just a moment. Now I'd like to talk about COVID-19. The update for us is simply that we are now about 1 year into the pandemic, at least when we learned that the pandemic was looking like it might take place overseas, and we really hadn't been affected as a nation. I don't think in January of last year, we could have quite predicted that what we were seeing take place in China was going to translate into what we've seen and have the impact that it's had in all of our lives in so many ways. As a university, we have managed to adapt to a new way of doing business, and we've been very successful in meeting our mission. We've just had to do it differently. We've had to tighten our belt, and we've had to reset expectations on how we can celebrate and come together as a group, utilizing virtual platforms. As the pandemic continues to create barriers, we're going to have to continue to adapt and respond, especially to many of the state and federal safety regulations that are changing as we learn more and more about the COVID-19 virus and ways to stay safe during that pandemic. I'm going to talk about a couple of these points, and one of those is going to relate back to the student forum on vaccinations. We are currently authorized as the Neomed Pharmacy, as well as Neovations, our pharmacy consulting group on campus, to receive the vaccine. We've been approved. We have the refrigeration system in place to be able to manage both types of vaccine, both Pfizer as well as the Moderna vaccine. We have not yet received information on when we might receive that, and that's going to have a great deal to do with the state's distribution policy and how they're prioritizing who receives the vaccine and when. Portage County has received vaccine and will begin vaccinations. In fact, they will be using our campus to implement the 1B strategy, starting with those individuals 80 years and older who live in Portage County. And we have partnered with them to allow them to use the new center space to do that, beginning on the 23rd of January, which is a Saturday. Now, they are working the ability to be able to get these vaccines out. And as I understand it, scheduling them, and we are, I believe, fully scheduled at this point. They're hoping that they will continue to have a partnership with Neomed and offer these weekly for at least the next 4 weeks, but much of that will be dependent upon vaccine availability from the state. And as I think most of you know, 1B is going to be phased in with those 80 and over first, and then eventually getting into a broader population as the weeks progress, something the governor's office has already released in part of their campaign. Now on to the issue of our students who are really 1A and should be getting vaccinated by the health systems. As a result of the meeting that was formed with our students that I had just recognized, we had an agreement with our health systems partners that we would begin the process of scheduling and vaccinating the clinical students, something our health systems fully supported and we're working to be able to implement for us. This has really become more of a question now, and I'm going to ask our students who might be listening today to remain attentive to this, to remain advocates for yourself and for the other students in the state of Ohio, not just medicine and pharmacy, but nursing, podiatry, and other clinical students who are out and face extra risks by being in the healthcare setting. We've been informed by one of the health partners that the state has contacted the health systems and told them that the time for 1A vaccinations was over as of midnight last Saturday, and that they were no longer to do healthcare provider vaccinations, that they were moving on to 1B, which included the most at-risk population who accounted for greater than 80% of deaths from COVID-19. We are continuing to advocate for our students, as are the other medical universities in the state of Ohio, with the governor's office, with the chancellor's office, and with the Department of Health, to get them to look at this to ensure that we are being fair and equitable with allocation of vaccine, and to ensure that any students who are going to be in the healthcare workforce and may come in contact with COVID patients, or at least have a reasonably high risk of doing so, can get vaccinated. For now, scheduling, as was already underway with those health systems, you may find that they are canceling those or at least putting them off. Please understand, this is not our health systems partners who've stepped up to help you, to help us, and recognize the importance of vaccinating you. They are receiving guidance from the state government that they are not to allocate those, and not just to our students, but not to allocate those to their own personnel, including their physicians and their nurses and their frontline healthcare workers. So please stand by, stay tuned. We're continuing to advocate for you. I just don't have an answer to give you on whether or not we're going to be successful in getting this changed sooner, or whether we're going to simply have to follow the state's phased-in process as they progress through the different tiers. There will be formal messaging coming out from the university on this, giving you guidance and keeping you up to date on what we learned from our advocacy efforts with the state on this. Testing is another issue around COVID-19 that the governor's office has asked us to really step up and increase so that we have a better understanding of where campuses are relative to COVID incidents. The governor's office originally asked us to do 3% asymptomatic testing of our on-campus population. We are now being highly encouraged to move to a 20% on-campus sample testing. This is meant to be random testing. So we are working with our COVID task force. Dr. Joe Zarconi, who leads that task force, has been working to get us testing capabilities. It looks like we are going to have a large access to the BinaX point of care testing, much like we did just before Thanksgiving, but in greater numbers, and we will be buying those test kits ourselves. If not, we'll be working to arrange testing through an alternate source. As part of what the governor is requesting from us, we will be creating a database from our current servers on total population on campus. That's students, faculty, and staff. And we'll be contacting you via email to indicate that you've been randomly asked to come in and undergo on-campus testing. This is something that is simply for monitoring purposes, but those individuals who test positive under the asymptomatic testing will then be asked for a confirmatory test through PCR, as the BinaX tests are currently emergency use authorization for symptomatic individuals. Those tests for symptomatic individuals will also be available on campus. That will likely be handled through our new clinical enterprise on the second floor of the medical office building. So there will be messaging, communication coming out on this from the university. We are simply following what the governor's office is asking of all the universities in the state, but especially the public universities that report and are funded directly by the state of Ohio. I would also like to make our community aware of the concern for fraudulent retirement claims. This is a new trade that's been developed during the pandemic by those who are abusing the system and trying to fraudulently claim dollars from the state. We've had 13 of our faculty or staff identified by the state to our HR office that someone had fraudulently filed retirement on their behalf so that they could be able to gain access to those retirement dollars. Our HR team is monitoring this. If we've identified you as one of those individuals, we'll contact you, and we are moving forward to get this corrected. However, we're also going to recommend that you independently reach out and ensure that your credit records and other financial records are not being affected. They are not gaining access to this information from Neomed databases. They are bringing this information together broadly, including your social security numbers, in order to be able to do so. So stay alert, and we are staying alert for you also, and we'll continue to send information out on this. We're expecting a release of information from HR over the next couple of days to tell you what to look for and what to do if you're affected by this. I'm pleased to say that we have received additional federal funding for calendar year 2021 as part of the first stimulus packages coming forward to help higher education. And as part of that, we'll receive $136,000, much like we did last year, to give out in student grants for those who are affected by increased costs due to the pandemic. So for our students out in the audience, we will be reaching out. We'll go through the same type of process that we did last year in and around March, April timeframe to ensure that we can make these dollars available to you, likely on a first come, first served basis. We are also working to take care of our faculty and our staff and making this a priority during these difficult times. Even with the significant financial belt tightening that we've had to undergo on this campus because of economic losses associated with the pandemic and with the tax base with the state of Ohio, We've managed in January to at least give an increase to base pay, so a raise to all of our faculty and staff. This is a 1% increase that will help to compensate for inflation, which actually has been quite low during the pandemic. And you'll note that we've moved to a new insurance carrier through Summa Healthcare, offering you the same high quality and extensive package of access to care that you've had in the past, but doing so in a way that for most of our faculty and staff is going to lead to a substantial cost savings. And for many of you, this equates to an additional 1 to 2% of your total annual base pay back into your paycheck for you. And our team at HR and operations are going to continue to advocate on your behalf to look for these types of opportunities so that we can continue to save money while ensuring you're getting at least the same, if not better, access to benefits. I want to thank the entire university, but especially those of you who put in the hard work to help us with our LCME, Liaison Committee for Medical Education, inspection that will be taking place in February. This is a second time back to look at specific areas that they had concerns about. I think the College of Medicine leadership team has done an incredible job putting together a self-study after first implementing corrective actions and looking far forward into the future to ensure that we're not just correcting, but we're actually implementing better programs, many of which will be vital in keeping us ahead of changes in the way we educate and compliance with LCME. The self-inspection is being turned in. We will be reviewed by LCME in February, and in June, we'll be able to share with you results of that process. And we all believe that we're in a good position. And many of the opportunities that were highlighted by the LCME has resulted in very substantial and beneficial new programs to the university that's going to affect our ability to be better at what we do. So thank you to all of you. And with that, I'm going to stop and I'm going to open it up for questions.
Yes, the first question is, if we are chosen randomly for testing, is it required or may we decline?
So the governor's office has told us that we need to, well, we've been essentially mandated. I'd say mandate is a strong word, but highly encouraged that we do this testing. My intent is that we are all good citizens of this university and are all working to keep this a safe place for all of us to be. And that I'm asking you, if you are selected, to come get tested. I currently do not intend to have any sticks or carrots, meaning nobody's going to have anything done if they don't show up, and nobody's going to be given anything to incentivize them to show up, at least for now. This is really about being a good citizen and looking out for the health of each other.
When you made reference to the fraudulent activity, were you talking about retirement benefits or unemployment benefits?
As I understand it, we've had 13 individuals who've had retirement filed on them. Whether unemployment has also been an issue associated with this, I'm not certain, but I know Mr. Burton is online and he certainly can put something in the chat and potentially correct me if I got that wrong. But these are fraudulent filings in order to gain dollars from the state that would normally be part of a benefit package to our employees once filed for.
Can you please provide a brief update on the Millerman Group's efforts to address pay disparities among staff positions?
Yes. So when we went through the Millerman Consulting Group, the intent was to look at where we are regarding classification of employees and where we are relative to offering market rate. So being comparable to those who are considered our peer group in industry. This is a way for us to get a check on how are we paying individuals relative to how others are paying individuals. Now I'll tell you that the caveat is they compared us to a time prior to the pandemic. So we know the data is not current. And in fact, it's to the benefit of our employees because many of our peers have actually reduced the salaries of those who would be considered your peer group. And many have also laid off or furloughed those individuals. So what we've done is taken that data and looked at how we could phase in a change to get us back to market rate. This isn't to say anybody's underpaid. It's to say that when you look at your full package of benefits and salary that you took, we'd like to get you to a different level so that we can recognize you for what you do and to retain you. So we've created a plan within these more difficult economic times to be able to get our employee base to that level. And so we've given a 1% increase, which has actually corrected a number of our employees to being at market rate. And for those who were not, we're phasing in a half overall correction to salary now, and then we're going to phase in the other half, ideally at the next fiscal year, sometime around July. There is also going to be some reclassification that takes place. That's a longer term initiative over the next 1 to 2 years, where we're going to take some employees and move them into positions to classify them differently, but only to your benefit. We do have, what we learned from Millerman is we do have some people that are classified higher than they should be, or they are actually getting paid higher than market rate. Now, we are not going to take away. So those individuals are not going to have anything removed. This is not meant to be a foul to anybody. This is meant to improve the overall compensation and to be in line with where our market share should be. So corrections are being phased in. Some of you will see that now. Only about 10% of our entire faculty and employee base, this is really about staff base actually, only about 10% were either slightly or a bit below market, and another few percent were above. So it's those who were below, we're going to phase in those corrections. And some of you were corrected immediately with the 1% increase to base.
Does Neomed's leadership and Neomed's board condemn the violent attack and attempted insurrection led by President Trump and an angry mob in the nation's Capitol building? If so, why didn't the university issue a statement 2 weeks ago condemning the attack led by the people hanging nooses, waving Confederate flags, and causing violence in an attempt to overturn a free and fair election?
So the university's role is to take care of our mission, and that is education, research, and our community. We do not reach out and comment on every event that occurs nationally. We have to worry about really waving more fuel into the flames and creating new issues. You note in this comment the insurrection led by President Trump. I can neither tell you whether he led one or not. You can make your own judgments based on what's been read and what's been perceived based in speeches. I'm not here to evaluate that. That's for our government to do, and that is being managed by the legislative branch. We certainly condemn any act of violence by any individual, especially at this time where we just came off a 3-day break where we were honoring the life of Martin Luther King. Dr. King used non-violence to advocate change and did so very effectively. And we certainly condemn any acts of violence. And I'm at this point going to leave it at that. I do not want to get into the politics of what has really become divisive and a very divided nation. So I don't think that's the university's role to do so. We are here to educate healthcare professionals. We are here to look after the health and wellness of our society by offering better ways of improving healthcare and wellness. And I'm going to leave politics to politics, and for you as citizens to be able to advocate for the side that you feel you should advocate for. We will just condemn the use of violence for any purposes.
Summit County is allowing people to sign up for vaccine appointments. If we live in that county, should we sign up for a vaccine there or wait to do it at Neomed?
We had this discussion today at part of the executive management team, and what we're being told is that Portage County is only servicing Portage County and Summit County is only servicing Summit County. At least that's what we understand right now. I would recommend that you sign up where you're being offered to have it given to you and get it as soon as you can. We do not know when Neomed is going to get it. And when we do get it, we're going to be required to follow state guidance. Meaning if we get it, we can't jump to 4 or 3. If it's during 1B, we're going to be mandated by the state to only give it to those individuals who are 1B. So get it where you can. And if you're being offered the opportunity to schedule, I would schedule it as soon as you can, where you can.
Will internal equity be addressed? Many in the same pay grade have discrepancies in what they are being paid compared to their peers in the same pay grade.
Now, we are working hard with HR to do that. That was the intent of Millerman. Now, this is a study that was completed for us by the end of September, early October, while we were also in the process of dealing with the pandemic. This is the first phase in trying to get our entire staff at an appropriate level with market rate and appropriate for what you do. So there will be some reclassifications taking place. And Mr. Burton is working on that with his team. It's not something we can do overnight, but we are advocating for you and moving forward, trying to get things corrected for not just our staff, but also for our faculty. One of the promises I made when I came here, and one of the reasons our Board of Trustees brought me on and has tasked me with, is ensuring we are appropriately valuing our employees, our faculty and staff, and doing what we can to attract, grow, and retain the very best people to be part of Neomed's mission. So we are working on it. It's just not something that happens overnight, but I promise you we are working on it.
How will we know if our base rate will be updated due to the market rate changes?
You will be contacted by HR, and you should be informed by your supervisor when that occurs. I will note, though, that it is going to be a small percentage of individuals. We were actually, I would say, a little surprised given what I had heard coming here before I started, but pleased that it was 10% or less of our entire staff that were either just a little bit or maybe a little bit more extensively under market. So 90% will not see a change because 90% are actually being paid at or above market rate.
Most of the counties are allowing, if you live or work in those counties, to get the vaccine and sign up there. Best check with the county. Should we follow this or should we just wait until Neomed puts out more information about it?
You know, when it comes to your own personal health and welfare and getting the vaccine, I would advocate for yourself. We too are advocating for you, but you need to do everything you can. And if you want the vaccine, I would recommend the vaccine, but this is something that is not currently being mandated nationwide. So if you decide you want it, I would advocate for yourself and look for any avenue through which you can get it. It's just, you may get better information and better opportunities outside of the Neomed channels. We're working hard, but currently do not have access to any vaccine or are completely dependent on partners and the different county Department of Health to do that.
Just to close it out, there's no further questions, but a few comments just to thank you for your unifying responses to the questions about January 6th.
Thank you. Thank you for all that you do for us. We've got a great mission at this university, and we're going to continue to move forward to graduate outstanding healthcare professionals to serve Northeast Ohio and all of Ohio, to look after your health, continue to do great research to advance the science of medicine and pharmacy, and to continue to serve our community. And we can only do that through you. It's not through me. It's not through the leadership team at the executive level. It's through everything that you do, and we can't do it without you. So thank you to our great campus community, and thank you to our Board of Trustees who continue to support everything that we do. Have a wonderful week.